Matthew, and today we're going to talk about depression. Depression is a common condition. It affects about 30% of the population at some point in their lifetime. And really, it's more of a symptom than it is a disease. There are a lot of different things that can make people depressed. The most common cause is low serotonin. However, people can be low on norepinephrine. They can have low thyroid. They can have abnormalities of cortisol. There's all kinds of different things that can cause someone to feel depressed. In all of these cases, what's going on is that someone is having decreased energy usage and function in the prefrontal portion of their brain. And so this causes it to be more difficult to solve problems and those sorts of things. And so problems build up throughout the day and become overwhelming as you're not capable of solving them. The most common treatment that we use for depression is medications like serotonin reuptake inhibitors. The vast majority of people with depression will respond to medications like sertraline, also known as Zoloft, or escitalopram, also known as Lexapro, though there are many other treatments. As we evaluate depression, what we try to do is look at other symptoms. Are you depressed, but you also have dry skin, hair, and nails, and you're constipated? Well, we should take a look and see if you have low thyroid. Are you having, other problems with, changes in the appearance of your face? We call them moon faces, and weight gain at the same time. That might be an indication that someone has Cushing's disease. Well, then certainly we would check their someone's cortisol level or those sorts of things. And so a evaluation and possible laboratories might be indicated depending on what's going on. But the vast majority of people will get better. When it comes to depression, most people have, if they have a depressive episode, a single episode of what we call major depression. If we don't treat it, it will generally resolve in about 2 years. With medication, it generally gets better in about 2 months. When we do treat it, what we like to do is have you take the medication for about 6 to 9 months, even though you'll feel better in a couple of months, because the medication actually helps you to heal faster. I like to explain it like a cast. If you break your arm and I put you in a cast for 2 weeks, you take it out and you're like, hey, I feel great, snap. In the same way with depression, antidepressant medications do help the brain to heal faster. And so what we want to do is support you until things are strong enough that you can fly on your own. If people have a single episode of major depression, there is a 30% chance that they will have a second episode of major depression in their life. If they have a second, there's a 70% chance they'll have a third. If they have a third, there's a 90% chance that they'll have a fourth. So the more often someone's had depression, the more likely it is to come back again. These are things that we look at in terms of choosing therapies. In addition to medications like SSRIs, there are SNRIs, which are going to affect a different neurotransmitter. Some people may appear to be depressed, but actually have bipolar disorder. So we ask questions about those things, including questions about people's sleep, just to make sure that we give people the right sorts of medications. Some people may need to be treated with more exotic means, including vitamins or those sorts of things, if they have B vitamin deficiencies. And one of the newer treatments that we have is transcranial magnetic stimulation. And that works very well for people who have resistant depression, which doesn't respond to other things. In that case, you go in to a psychiatrist's office. They have a special magnet that's set up next to your head, and it rapidly switches the magnetic field, which generates some current in your deep brain, which improves blood flow and allows the brain to heal faster. And people with resistant depression will often see an 80 or an 85% response rate to depression with the transcranial magnetic stimulation. In really, really severe cases, sometimes depression is treated with electroconvulsive therapy, but that is quite rare and generally reserved for people who are in really bad shape. Those are some of the basics about depression. If you have questions about feeling depressed, if you feel like your mood isn't doing as well, we're always happy to see you in the office, and I hope you have a nice day. Thank you. Bye.